For you tonight, I'm Jesse Rogers. Our sign language interpreter is Meresha Owiti. Let's begin with the latest from the clinical officers, where you should expect further disruption to health services in public facilities across the country after the Kenya Union of Clinical Officers announced the beginning of their strike. As our reporter Catherine Imuraget details, the clinical officers highlighted that despite continuous engagements aimed at realizing the past CBA since 2017, a resolution to that effect still remains elusive.
It has been a long but tough moment for patients across the country after doctors downed their tools. But it seems like when it rains in the sector, it pours. Clinical officers have joined in. They are accusing the Ministry of Health and Council of Governors of inaction in addressing their grievances. They say this is despite negotiation dragging on for years now.
We have not been able to conclude in the time we had agreed, which was supposed to be 90 days. For the Council of Governors, they refused to come. So we decided to be magnanimous enough, and on 4th of March, we gave a petition and gave them 14 days because we didn't want to go on strike. And even after they didn't respond after the 14 days, we still gave them another 7 days.
According to officials of the Clinical Officers Union, their demands have never been addressed by the government. For this, they are now calling on all clinical officers to join forces in support of the change they are pushing for.
And we say, pole to Kenyans, because we have come to this situation, and we must say they must support the change we are pushing, because this is what is going to guarantee services whenever they need them.
They claim the government's move towards placing the health sector under national government will not give solutions but only kill the public facilities.
If we find that we are going on strike and no one is daring to make decision on how we move together and enhance the service delivery, then it is a clear indication that indeed we are only supporting the private sector, which they are the owners of those private sector, and killing the public sector.
Like doctors, they are also pressing the government to take care of intern clinical officers.
This time around, we want full implementation, and we want them to disregard the advisory of the SRC and do what they are supposed to do. The SRC mandate is on the public servants, and these interns are not public servants. They have not been classified as public servants.
The strike will be ongoing in all public hospitals except referral facilities. Services in over 4,000 public hospitals are expected to be disrupted. Catherine Oise, KTN News, Nairobi.